The fontanelles are soft, membranous sutures that have not yet ossified in the developing skull of infants. There are 6 fontanelles: anterior fontanelle, mastoid fontanelle, sphenoidal fontanelle, and posterior fontanelle. Fontanelles are sometimes referred to as soft spots. Fontanelles allow the skull to be compressed during childbirth as an infant passes through the birth canal, and also to allow the brain to continue to grow. At the time of birth, the brain is only at 25% of its adult volume. At 9 months of age, the skull is already half its adult size. Then at 2 years, the brain is 3/4 its adult size. Finally, the brain is almost its full adult size around 8 to 9 years. The fontanelles are examined regularly by doctors to ensure the health of the baby. Bulging, sunken, or enlarged fontanelles may indicate a various number of diseases. For example, a bulging fontanelle may be the result of increased intracranial pressure and ultimately caused by encephalitis, swelling of the brain as a result of an infection, hydrocephalus, a buildup of fluid in the brain, or meningitis, an infection of the coverings of the brain. A sunken fontanelle suggests dehydration or malnutrition. Enlarged fontanelles may be caused by diseases such as Down syndrome, premature birth, hydrocephalus, or an intrauterine growth restriction. Pulsations of the baby's heart can also be felt at the fontanelle sites, and the pulsations feel similar to surging water. Interestingly enough, the word fontanelle means little fountain. The anterior fontanelle is a diamond-shaped fontanelle located between the frontal and parietal bones, and measures about 2.5 centimeters in its transverse diameter. The anterior fontanelle is the largest of 6 fontanelles. The anterior fontanelle is replaced by bone generally between 18 to 24 months after birth. It is the last of the fontanelles to ossify. Once the fontanelles ossify, they form sutures. The pair of mastoid fontanelles are located on the sides of the skull between the parietal, occipital, and temporal bone. The mastoid fontanelle is the third fontanelle of the 4 to ossify. It ossifies 6 to 18 months after birth. There are 2 sphenoidal fontanelles on both sides of the skull where the frontal, parietal, zygomatic, and temporal bone meet. The sphenoidal fontanelle is the second fontanelle to ossify, doing so around 6 months of life. The posterior fontanelle is a small, triangular fontanelle located towards the upper rear portion of the head. At birth, the posterior fontanelle averages between 0.5 centimeters and 0.7 centimeters in diameter. Differences in the fontanelle sizes are based on ethnicity. Infants of Hispanic, Chinese, and Nigerian descent have been reported to have the largest fontanelle diameters of all descents. The posterior fontanelle ossifies at about 2 to 3 months, and it is the first fontanelle to ossify. Craniosynostosis results from premature closure of fontanelles and sutures. The cause of craniosynostosis has not yet been determined. In the United States, 1 in every 250,000 individuals are affected by this disease. Infants with craniosynostosis require brain surgery, ideally within the first year of their life. The surgery involves a neurosurgeon incising across the top of the infant's skull and then removing the misshapen portions of the skull, reforming the portions of the removed skull, and lastly placing them back inside the skull. Ultimately, by fixing the misshapen portions of the skull, the surgery should create sufficient room for growth of the brain and prevent developmental delays and increased cranial pressure. Another genetic disease due to an increased posterior fontanelle an incomplete ossification of the parietal bones, is known as enlarged parietal foramina. Enlarged parietal foramina is characterized by large openings in the parietal bones. These circular, symmetrical openings can vary from several millimeters to a few centimeters. The two types, type 1 and 2, of enlarged parietal foramina differ in genetic causes. Some individuals with enlarged parietal foramina may experience scalp defects, associated headaches, seizures, and structural brain abnormalities. Individuals with this genetic condition are also at an increased, yet typically minor risk for brain damage or skull fractures if any trauma, such as pressure to the openings or penetrating injury to the brain, is experienced near the openings. This video demonstrating the Fontanelles was prepared as part of the course requirements of Human Anatomy at Saddleback College.